Thank you for staying with us on Kakaaki The African Voice. You do know that on a day like this, every last Wednesday of the month, we'll bring you Kakaaki Cancer Awareness, and we do this in conjunction with Cormode Cancer Foundation's CEO, talking about Dr. Denise Ejoh.
Yes, Dr. Ejoh is joining us now. She will be taking charge of this segment of Kakaaki The African Voice, looking at the patient voice, power, and accountability in cancer governance. You'll be doing that with Professor Abubakar Bello, the president of the Association of Radiation and Clinical Oncologists of Nigeria, ARCON. Dr. Denise, good morning. Good to see you again. It was lovely seeing you here in the studio, but good to see you back in your natural habitat.
Isn't she beautiful?
She is lovely.
You're always there. Morning, guys. How are you? Very nice to have seen you. It was very nice. It was good. Thank you. Okay, let's move on. Let's go. Thank you. Good morning, viewers. Welcome to another edition of Cormode Cancer Awareness segment in partnership with Kakaaki Cancer Awareness. You know, that's how I always called it. We begin another episode with Dr. Denise Ejoh, founder of Cormode Cancer Foundation. And with me today, I've got someone very special to me, and that's the president of the Association of Radiation and Clinical Oncology of Nigeria, ARCON. Let me just put it, I'm going to use ARCON throughout the conversation. So today I've got somebody very special, and his name is Professor Bello. Prof, good morning. How are you? It's very nice to see you. You're looking very fresh.
Thank you so much, Dennis. You are looking fresher, actually. So good morning, Nigerians, and I'm happy to be here with Dennis again, who is a well-known advocate of global stand, actually. So
yeah,
nice to be here. Right.
Thank you. So today we're looking at patient voice, the power and accountability in cancer governance. Now, this is February, so together we fight, together we win. We are asking difficult and necessary questions about cancer governance in Nigeria, because governance determines survival. And for us that are survivors and patients, we have to ask these questions. Behind every policy gap is a patient, and behind every delay is a family. Joining me, as I've said, is Professor Bello, who is president of ARCON. So let's sit back and let's get an understanding of how we can change the narrative for cancer patients. Professor Bello, good morning, and thank you for joining me on the hot seat.
Thank you again. Thank you for inviting me, and thank you for inviting ARCON, actually. So it's not Professor Bello here, it's the association itself. So I'm representing an association. So thank you for having us.
Thank you. So for years, cancer policies have often been designed without structure of patient input. And we have to admit it. And I'm very happy to see that globally there is a change in the way things are going. So let's now look at ARCON. So how will ARCON formally integrate cancer patients and patient advocates into national oncology planning and advisory structures, so decisions are not made in isolation from lived experience? Because that's that's what we've always had.
Yeah. So actually, you're absolutely right that in Nigeria, historically cancer policies are driven, by professionals, not patient-driven, and that really has to change, because globally, cancer policies are driven primarily by patients. And so what is important here is that ARCON is, trying to have a formal integration plan, where we have patients' representation in national cancer policies, advisory boards. You recall that there was CHF, the Cancer Health Fund, and there are very few patients advocates on that fund. So we want to change that narrative. We want to make sure that patients are actually properly represented. And when we go for accreditations also and review boards, we want to make sure that patients are also involved. And especially in hospital cancer governance councils, where decisions are being, conducted for patients, patients must have a voice there, and this is what ARCON is planning to do. We must find a way of creating, a structured patient advocacy desk, within oncology centers, within oncology institutions in Nigeria. And then we also want to have something like what I called the National Patient Feedback and Reporting Systems, where patients are critically involved, in giving feedback on how we manage them, how we treat those patients at the national level. So it's a work in progress, but I hope that we will be able to actualize most of these things, because access is very critical. Access is so important. And then, when you don't allow the patients to decide whether you want to have a research priority settings, or where you want to have a service design, and the patients is not central, then you end up making that the patients, becomes just an afterthought, and that shouldn't be happening.
Awesome, because you've just led me on to the next one, which is to do with the reporting system, because that is very key for it to make it significant. Should cancer treatment centers in Nigeria publicly report treatment capacity, waiting times, and outcomes? And if yes, what steps are being taken? Now, currently, you have brought out some steps that are generally designed in line with what you're saying about ARCON's next move. So now with that, are there specific things that we can look out for? Because you're just starting as the, oh yes, thank you, congratulations as being the president. I forgot, I'm sorry.
That's fine.
Yeah, as being the head of, the president of ARCON now. So what steps are now, what are your plans? What are your plans? Transparency is our key thing for us, because
yes. So, well, thank you so much for that. The club and all that, it is well noted. I was president of the African Organization for Research and Training in Cancer, which is a continental organization. So I'm taking advantage of my experience from that. Yes, so your straightforward answer is yes. We should have some, accountability. We should have some reporting systems that is absolutely necessary. And why is that? It will drive accountability, and it will improve planning, if we are reporting some very key important, and then importantly, it will also build the patient's trust. So what should we be reporting? That's the question that we need to know, number of functional machines, for example, how many machines are functioning in the country, where exactly are they located? Patients should have awareness on that, and when we are talking about reporting, it's both ways. We should be also reporting also to policymakers, like the volume of patients that we actually have, in a particular, location. For instance, if you look at the National Hospital where I practice, the volume is staggering, because, you will travel hundreds and hundreds of kilometers before you will, have another radiotherapy machine. And so we need to be reporting things like that. And average waiting time, a lot of patients actually die waiting for treatment because of the sheer volume of patients that we have, and so there is waiting time, in literally all the cancer centers. Nigeria, for example, requires about 220 radiotherapy machines, for instance. That's the IAEA statistics, but we have less than 20 for a country this volume. So you can imagine that in so many centers, a lot of our patients have to wait, and that is not so good. So these are things that we should be reporting, And then, of course, indicators, basic outcomes. What are the treatment outcomes? Are we making any progress? Are the patient responding? And this is where patients and advocates come in. We need to involve them so that they will be given a lived experience. Live experience really, it's very, very critical, and they are the ones that will be able to drive the narrative going forward in a country's policy dream. Yeah.
Thank you. You did some things for me, so I'm going to go straight to one that everybody wants to. Financing this cancer care. This finance is always a big issue. Always a big issue. Always a big
Finance.
issue. Yes, because I want to come back to the end. So let's do this. Now let's talk about this cost. Cancer care in Nigeria often leads to catastrophic spending bills, and we all know that. Now I always say to people, let's not say just Nigeria, it's a global thing, because the cancer community is a begging community globally. It's not about Nigeria. The expenses are true for anybody. Okay. Families sell property, some feel abandoned, some have to abandon. Yeah. What role should ARCON now play in influencing government to expand this insurance coverage? Because last year we had a debate as to how much really came out for the Cancer Health Fund for cancer patients. And from the cancer patient's perspective, no. From other sources, they say there is. Who is cancer patients are the ones that are receiving it and saying they didn't get any money.
Well said. I will join the advocate also to say that they didn't get any money, But importantly, we must also agree that cancer should not be financial ruin. A lot of people, like you mentioned, have to sell properties because treatment of cancer is expensive. And that is where the comprehensive NHIS coverage packet comes in. There was this bill that was passed that every Nigerian should have National Health Insurance Services coverage, and everyone should register. And that includes cancer patients. So we have that should support not only radiotherapy, should also support chemotherapy, surgery, diagnostics, and what have you, and especially high cost drugs. You know more than me how expensive, some of these cancer drugs are, because you've been there, you've been there, and you know how much you have spent. So ARCON's advocacy is targeted around creating awareness for patients or Nigerians to be able to reach out to the NHIS before they even have any cancer. I think that is very critical, because that fund is grossly inadequate, and it is just for 3 cancers, breast, cervical, and prostate cancer, and which accounts for just like a quarter or 1/3 of all the cancers that we have in the country. So the remaining 2/3 are not covered by that fund. So we must have another way and another initiative to be able to support all those other cancers. And that is why we are also advocating for special cancer support funds, away from the Cancer Health Fund. So the idea is to be able to put everyone on board, because I do know that cancer can take literally everything that you have, no matter how highly placed you are. I had treated in the past a former governor who told me that, look, I can't afford your fees. Cancer has taken everything. After 10 years of treatment, he said he was living on charity. So if you can imagine a former governor complaining, then what happens to the low-income and indigent patients? So government and philanthropists also. You see, when we went to advocate for that CHF, the Cancer Health Fund, the idea was for government to pull in some money, and then we get some philanthropists as well to come and pull in some money so that they can support indigent patients and across board. Unfortunately, that second part did not happen. we didn't get a lot of philanthropists to support the fund. And so one of the advocacies we are doing is to reach out. We want to reach out to foundations, to make sure that there is enough pool. If every Nigerian will agree to pay 10 naira to that special cancer support fund, believe me, the issues of patients unable to pay will be a thing of the past. So these are some of the things that ARCON is working very hard to see that we are able to do that, and we hope that we are going to launch this at our annual conference that is coming up in September, and hopefully that we're going to get some support from philanthropists, from pharma, from patients advocates, and also from government organizations and what have you. And if we are able to get really exactly we want to put it the way we want to put it, we should be able to treat all patients that are indigent especially. Cancer is a serious business, and the treatment should not be based on how much you have in your pocket.
Thank you, Prof. Thank you, because you just made a statement which was interesting about the insurance coverage. So do people have to pay? Just a quick answer. Do people have to pay for this insurance? And what's the cost, if you know it?
Well, I don't have the exact figure, but there is a premium that people pay, and it's really negligible. And if you pay it, it's like, paying for an umbrella for rainy days.
Okay. The reason I've asked you is because we'll have to find it so that we can bring it back onto the platform, onto the space, when next I see you, to let people know how much this is and let them pay for it. It's better for us to know than what we don't know. It's not going to... There's a statement that you cannot completely hide under ignorance.
Yeah.
Okay.
Just to add that, a lot of pharma companies like Roche and many others have actually keyed into the health insurance and have given subsidized, pricing for most of the cancer drugs that are being used. So it's one thing that I will encourage every Nigerian to really go to the National Health Insurance and register.
Okay, so that's a good one, because I will go and register.
Yes.
Yes, because whenever I'm sick, I actually have to start running away, and I'm like, I panic.
Okay, so
in the next 2 years, or 3 years,
I
want you to give two things that you want us to look out for to measure your years. Yeah. And then after that, you're going to tell me about this this project, that there's a call for action that I need you to call. So 2 minutes, just give me those two things so that I can do the call for action.
Well, we are working very hard, and I hope that in the next 2 years, we are going to institutionalize, patient representation in policies, which is very important. We are also going to make sure that there is a national oncology standards, accreditation standards, so we can have better qualities, better access, and better accountability.
Oh, okay. Now I'm about to round up, and I want to ask you one question. Yesterday we had a conversation which was very important, and that was to do with people not registering for that because there's money for it. Can you please, in as quickly as possible, because my time is up.
So we have, thank you. So we have a study that I am the principal investigator of innovative cancer medicines, for colorectal cancer. These are fantastic drugs that are being given to patients at no cost to them, because we've been able to get support from the companies, the manufacturers of these drugs. They have provided drugs worth over 8 billion naira, and then they have also provided almost $1 million for supporting the patients while they are on that treatment. So they don't pay for any test, they don't pay for any CT scan, for any blood test, anything, admission, ICU, whatever. but it's primarily for metastatic colorectal cancers. Those are cancers that have spread, cancers of the lower guts. It's important that patients that have this should come to the national hospital so that they can benefit from this. It's not something that is new. Yeah, thank you.
Thank you. Please, all those that have colorectal cancer, please, you've heard, please just go and find out. At least go and get yourself tested and see if you qualify and get it for free. Please, there's no point. It's very expensive. We all know.
Yes.
Okay, Prof, thank you very much for coming on today. You actually did a very good conversation for me. Thank you. A lot of takeaways. Government is not about titles. We agree. It's about whether a mother starts treatment on time, a father completes radiotherapy without interruption, or a child even survives because systems works. So accountability is not confrontation, it's compassion structured into policy. When patient's voice is institutionalized, when transparency becomes a routine, when infrastructures are protected, and when financing becomes humane, survival improves. And that's the must be our collective commitment. Thank you, Prof. And to all Nigerians out there, please help us to live. I keep saying this thing. We need to live. And we believe that we can with you guys supporting us. So good morning, everybody. Today, I would say, together we fight, together we win. Follow us on our social media platforms. You will see everything out there and you'll be able to watch the videos and find out more. And to all of those who know me, please, I am raising money for two people very quickly, for a child and somebody else who needs the prosthesis. Please go onto the Cormode Cancer page and find out how to be part of that fundraiser for me, please. Thank you all, and we look forward to seeing you again in 2 weeks. Thank you, Prof. Thank you, Nigeria.
Thank you so much. Thank you, everyone. And you want to know more about ARCON, go to our website. Thank you so much. www.arcon.ng.
And the study, please.
Yes, Innovative Cancer Medicines in National Hospital. Please come. Thank you.
Thank you very much, Dr. Denise Ejoh there. And of course, time for us